Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today, as I am each month, I'm joined by Dr. Craig Joseph, the Chief Medical Officer at Nordic Consulting Partners, for our News You Can Use monthly episode. Craig, thanks for joining me today.
Well, it's a pleasure to be here as always. Thanks for having me.
We've had a little bit of news on the COVID front. We've now opened up the vaccinations for 5 and up, I believe, with Pfizer. We've also seen boosters opening up for not just those that are at clinical risk, but in fact to everybody. And I think of those two pieces, for me, the pediatric piece is probably the most significant because that's the biggest audience of folks who are potentially, I'm hoping, champing at the bit to avail themselves of the wonderful technology and science and innovation that we have created called vaccines that can prevent or at least mitigate much of the SARS-CoV-2 disease. Big group, but obviously parents worrying a little bit, something you've dealt with a lot. What are your thoughts?
Yeah, well, I agree with everything that you said. It's very exciting and, approved in pretty young kids now. Most of these vaccines are going to be given, unlike for the adults, in pediatricians' offices. So I think most folks don't go to their doctors to get their vaccines, although certainly at the beginning that was the case. Many of us now go to either a drugstore or grocery store or other third-party pharmacy. So pediatricians are the ones I think doing most of the heavy lifting here. And you're right. We know how to do this. I'm a pediatrician, and we've been a big part of our job is to explain to parents the benefits of vaccination for all kinds of different diseases. COVID is clearly a new disease, and the vaccine for it is relatively new. And so there are certainly reasonable folks who are concerned and have questions about side effects and long-term problems. The good news is we have lots of data, and for millions, hundreds of millions of vaccines given, and so we know that the risks are very low. Always there's always risk in everything that we do, but the risks are low, and so certainly I think we're seeing what we saw when the vaccines first became available to the public, which is those folks who have been chomping at the bit and really wanted them are waiting in line. And once we get through those, then we're going to start trying to, deal with the rest of the rest of the population that's open. There are people who've said that, hey, kids don't really get bad disease most of the time. That's true, actually. However, they end up children end up with serious long-term problems and potential death at rates higher than many of the vaccines that we routinely give. Polio is a great example of that. And so people who don't question those vaccines are now questioning this vaccine. Again, I think reasonable people can ask reasonable questions, but it's clearly exciting, and it is a whole new population of humans who can really significantly decrease the chance of them getting sick, of them helping to get others sick. Remember, we have folks all around us who are immunocompromised, who either can't get the vaccine or that the vaccine doesn't function all that well for them because their body can't create this immune response, can't mount it. And so the only way to protect those folks is to make sure that we're protected so that we don't pass on this SARS-CoV-2 virus.
So I've got to ask, this is news to me. I didn't realize that pediatricians were not in the game of giving vaccinations. When did that change? What was that about?
No, maybe you misunderstood. I'm saying that we've always been in the game of giving vaccinations.
Oh, okay.
What I was saying, and clearly not effectively, was that we were not in the game of giving vaccines to adults for COVID, right? So we've not been doing that. And I think that most people have gotten their vaccines not from their their internist or their family doctor.
Right.
But from a third party, either the vaccine site or the pharmacy. And so this is really the first time where most patients in a particular group, in this case, kids who are going to be getting these vaccines, they're going to talk to their pediatrician or their family doctor. And lots of research has showed that your doctor is someone that you trust, as opposed to someone on TV or someone that's got a podcast who may or may not know what they're talking about. And so
hold on a second. You're saying you don't trust podcasts?
No, like for this podcast, one of us clearly is informed and authoritative, and then there's you,
and the other clearly, who knows?
I don't want to name names, but it's not me, and no, I'm pretty excited though that people parents are going to get good information because they're going to get it mostly from their pediatricians, and then they can judge, what they want to do based on that. I think that's a much better outcome for everyone when you get information from your doctor or another trusted advisor, as opposed to from TV.
And it's interesting, obviously my ineptitude and understanding, and as people listen to this podcast, it'll be interesting if people listen to you and say, what the hell is Nick talking about here? But put that to one side. The reality that you point out here is actually really important. And maybe that would have changed a little bit of the trajectory of our COVID vaccination rates if that vaccination had taken place more so in the physician office, where there is that relationship, or hopefully there's that relationship, and an opportunity to question. And you're right, that's been part of my experience as a physician with 3 children who went through vaccination, and we would go and that would be part of the experience. But that wasn't the case with the adult vaccination. And it isn't with, I think, almost any, I can't think of the last vaccine that I received at my physician office. He just tends to say, oh, have you had X? Well, you ought to get it. And that's about the beginning and end of it. It seems like there needs to be a little bit of a closing of the loop here, but okay.
Yeah. Well, certainly, like I said, pediatricians, since there have been vaccines, it's been one of the major things that we've done. And, I think it's hard for many people to understand how successful the vaccines are that we give for routine childhood diseases. And we call them routine childhood diseases that we don't see. And, just to kind of make that even more clear, when I was a resident at a big children's hospital, I would admit kids every night that I was on call to our infectious disease floor with meningitis and other kinds of serious infections. And I was talking once with one of my attendings who was not significantly older, maybe 20 years older than me. He wasn't archaic. And he had said that when he was a resident, every night he would admit 2 or 3 kids with Haemophilus influenza type B, or HIV, Hib meningitis. It's like, that's what we did every night. We just admitted kids with Hib meningitis. And then he asked me how many kids with Hib meningitis I had ever admitted to the hospital. And the answer was 0. And I said, I didn't realize that was a thing. He said, well, it really was until we got a vaccine for that disease. And now, look, you're a resident at a big children's hospital. You don't even know that that's a thing. Because it's gone away. And so these vaccines are important. And we know what happens when we stop using some of these vaccines. These diseases that were very common and now are rare, if not gone, they come back. And I think that's part of what we're seeing now with COVID. People were vaccinated. They got either 2 of the mRNAs, at least in the United States, or 1 of the J&J. And now we're finding that, hey, looks like almost everyone needs a booster. And so we're seeing some of the diseases pop up. We're seeing, COVID start to come back in areas, even in areas with excellent vaccine coverage,
right?
Where 70% or more of the population has been vaccinated. Starting to see patients, starting to see the disease pop back. Now, folks who are at highest risk, the ones who are in the ICU and dying, are generally still the unvaccinated. But how do they get the disease? And they might have gotten it from someone whose immunity had been weaning. As we learn more, we become smarter. Is COVID going to be something like the flu, where you have to get a flu shot every year? We don't have to, but you should. I do.
I did.
Yeah, I got mine. I got mine last year. I got mine this year. Everyone should get a flu shot. If you're 6 months of age or older, you're eligible for a flu shot in the United States, and that's something that you should absolutely pursue. And it might be like that for COVID. Who knows? We don't know.
We don't. And, to be clear, certainly on the stats that I'm seeing with some of the clients and people that I'm talking to, we've seen a big uptick in flu. And that would be an area of at least something that people could do. I think you're right about that waning immunity and the contribution. We clearly did not get to herd immunity, and that has consequences downstream. The one thing I do want to say, and I'm going to call it out, I've done it a couple of times. Will the media please stop with the needles in arms as part of the stock footage for every single item that talks about COVID, vaccination, boosters, non-boosters? I'm going to shout out to Amy Baxter. She has Pain Care Labs, and they have Buzzy, which is the little attachable unit that attaches. Very effective, huge amount of needle phobia. And I got to be honest, I looked at all these things. I don't. It's never bothered me, fortunately. But it was my wife who pointed it out to me, and she says, it really upsets me every time to watch the news. And of course, we're not doing ourselves any favors. So I think we should really stop that at this point. But, as part of that, you bring up, where the vaccines were occurring and where we went, which was the pharmacies. And we saw that CVS is closing 20% of their pharmacies because they're not fulfilling the purpose. What's going on? I mean, I thought they were the humdrum of, healthcare delivery in the local community.
Well, they are. And it's an evolution, and that we're seeing where drugstores are becoming much more than drugstores, are becoming healthcare providers, right? And so Walmart has been kind of putting a toe in there, getting some clinics into their stores, including dental clinics. And so CVS has come out and said over the next 3 years, they're going to close 900 stores. They haven't decided which ones yet, but and the purpose of their 900, or about 20% of all of their stores, is to focus on digital health and focus on becoming much more than a drugstore and a pharmacy, but in fact becoming a healthcare provider, whatever that means. And so likely what that means is a significant chunk of their physical space is going to be given over to clinics of some sort. You'll maybe see doctors and nurse practitioners and physician assistants managing at those places. I think you'll mostly see primary care there, but they're really moving into becoming whatever the future of healthcare delivery is in the United States, and CVS seems to be on the forefront of that, and acknowledging that they can't do that everywhere, and so that some stores that are close to others and are either underperforming economically, or they can't imagine how they could make them perform in this new vision that they have. They're going to close them. I was just reading this morning saying that the dollar stores are likely to benefit from this, as they, if CVS or Walgreens and others that are everywhere close, the dollar and other kind of discount stores are potentially going to benefit by getting more traffic. And those stores, I think we've mentioned before on a previous show, are I think Dollar General, or one of the stores that's like that, hired a chief medical officer not too many months ago, with the idea that they also think that they can provide care. Or at least,
it's interesting. I think there's tremendous opportunity because it's in the local format. And one of the interviews that I did on my show was with the barbershop that was trying to deliver not just, it was healthcare advice, but it was sort of a supported environment in what essentially is a trusted environment for groups to be able to come in, ask questions, deliver basic health education, not just around COVID, but sex education, general sort of wellness, community-based sourcing for food and so forth. And, I think what bothered me about the 900 stores closing, and I recognize the economics of it, and no negative on CVS specifically, was that closed all of those community locations that are, as you describe, other people are going to step in. So I think in that sense it's good, but hopefully they step in with some healthcare, because that's really the value proposition, is that local element. Because we know we've got telehealth, but that's not the sole deliverer. CVS has clearly gotten into this health delivery. They are much more than a drugstore and a pharmacy. They're doing all of these. I mean, I even in at least one of the 4 that are equidistant from my property where I am currently, has a clinic set up, which I found kind of interesting, because I went and got one of my vaccines. I think it was the flu vaccine I got there. And it was this sort of separated area that had some soundproofing. It was a little bit of space. It had a printer, supplies, and you could step in and have a consultation without feeling like you were out in the open, which I've certainly seen in some of the interactions before with other vaccinations. Not that there's anything secret about it, but as you get into more detailed healthcare delivery. For those of you just joining, I'm Dr. Nick, the Incrementalist. Today I'm talking to Dr. Craig Joseph, Chief Medical Officer at Nordic Consulting, in our usual news you can use, Ask Me Anything. We were just talking about the CVS closures and the loss of about 900 or so of these stores, in part for a pivot by that organization, the stepping in of others. But it brings up this area that's sort of supportive of that I think we're seeing. I don't want to say my worst nightmare, but it feels like it's part of it, where COVID-19 accelerated some great silver linings. I mean, there's been no question there's been some positives out of it. And one of those has been telehealth, which people looked at and said, no, that's not good. Telehealth has been 2 years away for the last 10 years. And then suddenly it wasn't. And everybody realized that it had value. It's not a panacea, it doesn't solve all problems, but it really helps. It's fantastic. And now we're seeing, oh, no, we can't do that telehealth anymore, because we're going to change the rules. And suddenly, if you're in this state, you can't have telehealth. And I did respond online to somebody who complained about that. And I said, look, just say that you're in whatever state it is. I don't know how they can validate. And if they can validate based on your IP address, hello, VPNs, I can be anywhere in the world, which I am all the time. So, but it seems like things are going to shut down again. Are we going to lose all our telehealth?
It's what everyone has been worried about, and it's mostly not that anyone is saying you can't do it. It's just that, we're just going to go back to the old rules, right? That was the benefit, is that all these rules that were there for different reasons, to protect sometimes the public, or if you are more cynical, to protect private interest. Those rules are coming back, right? They went away during the public health emergency. In certain places, the public health emergency isn't there anymore. So for some of the things you're mentioning, hey, if I'm a physician and I'm licensed in one state, that's the only state I'm allowed to give medical advice in. And so that's what you're talking about. So if someone called and they were in a different state, I couldn't talk to them. And so a lot of that has been relaxed and is coming kind of back on. Those rules are coming back now. I think if the lay public were to think about this, they'd be like, well, wait a second, why can't a physician be licensed throughout the United States? Why would you be licensed in
Can I just stop you there? And this is a question I've asked for all the time that I have lived in this country, because I gotta say, I have taken 4 driving tests, and by the way, I passed them all, just to be clear. But it was the same with the medical license.
On the first try, did you pass them on the first try?
Yes, all on the first.
The public demands to know.
All on the first try. In fact, I've taken 7 in total, and that's in other countries. Now, I recognize driving is a little bit different side of the road. We drive on the correct side in England, those kind of things.
Yeah.
on a medical front, bodies do not vary. They do based on other factors, but not based on geography. I could never work this out.
It doesn't. I don't know. It's there's no national. There's no. Every state defines what a physician is and defines what is required to get a license, and so every state is different, and whether that makes sense or not is not completely relevant to the conversation, because that's not going away. So, but
it's not that it's not relevant. It's just an is.
It is.
But it doesn't make
what
any
it
sense.
is. Yeah, but so when the state of, so I'll just call out, I'll just make up a state, Florida. If Florida says, "Hey, we're okay,"
that's a real state, Craig. Did you not know Florida? Was that you said you were making up a state? That's not making up a state.
Florida is a state.
Yes,
okay.
It is. Yes.
I'm sorry. I was trying to make up a state, and I came up with one of the states. Gosh, I'm gonna have to work on my imagination.
Manchester. There you go.
No, that's a city.
Manchester.
That's a city. No, we're not doing that. So if a state says, "Hey, we are relaxing our rules, and now as long as you're licensed in any state in the United States, you can practice virtually in our state with our residents," that's fine. But those rules are all kind of going away. And same with insurance companies. Insurance companies relaxed their rules, whereby they used to have all kinds of requirements that, hey, you can't have a virtual visit with a physician that you've not already had an in-person visit with. And they claimed that this was required for quality reasons. Boy, we only want you to see a doctor that really knows you already. Or to decrease fraud. Hey, it's much easier for us to make sure that this visit actually did happen and we're paying for services that actually were provided if we know that there's a relationship there. And so those rules are from the payer side are also coming back, and slowly but surely, and it's disappointing. And so there are lots of I think there are lots of groups with horses in this race, and trying to make sure that we don't lose the forward progress that we made. Certainly, telehealth is not perfect for every problem. Getting back to CVS, though, it's actually funny. Over the weekend, one of my adult daughters called and said she's sick, and this is someone who's been fully vaccinated and and even after being fully vaccinated, had a breakthrough infection. Very, very mild. It was a cold, but she went for a test and came back positive. And now she's sick again, and she was asking me what to do. And what I would have liked to have said is, well, just have a virtual visit and talk to a doctor. But really, I think everyone knows, as long as she's not having trouble breathing and doesn't have a high fever and all of that, most likely we just need to know, is this COVID or is this not COVID? I'm not sure what we're going to do with that information, but I think that's part of the future of telehealth as well, is a doctor talking to you and saying, okay, I really do need a rapid strep test and a rapid COVID test. I'm sending those orders over to CVS. And so I need you to go 2 miles from your house, go there, just walk in, they'll know who you are, and they'll swab you, and then I'll call you in an hour or two. And so kind of an extension of where those doctors are. I know I've gotten a little off kilter, but yeah, so that's a concern. And I think everyone wants telehealth to continue. But again, like I tell my children sometimes, when you misbehave, this is why we can't have nice things. If we're going to see increasing amounts of fraud with these telehealth visits, then we're not going to be able to have nice things.
It's a constant bug of mine that it's always down to the lowest common denominator. It just takes one person in one instance, and then everybody suffers, which doesn't seem like the right way to approach this. And, it's interesting you bring up the telehealth and CVS, but, ultimately that shift to digital health would push out those capabilities for investigation. We've seen it with COVID tests that you can do at home. I've got a bunch of them. I did them for international travel. So there's some real capabilities that I think these companies can service. Unfortunately, as usual, we've run out of time. So this month, it just remains for me to thank you for joining me on the show, and look forward to next month. Craig, thanks for joining me.
You, and it was great.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.